Hey guys, how's it going? This is Ulysses again with Amici Hospice, and today's lesson is going to be on Slack reporting expectations. So, Slack is a communication platform that we use for our hospice. It is in real time, guys, and we really encourage you to use it. This is how we get all our information and provide information for the team. Now remember, communication is key here. It's the only way we're going to go ahead and be able to provide quality care is if we're all on the same page. The best part about Slack is that it is encrypted and it is in real time, guys. So this has to be a key factor in your care. This will tell you what happened last week without having to talk to anybody for the most part. This will tell you what medications were ordered. This will tell you what symptoms happened last night or what happened on call when you were asleep. It's imperative that you use Slack at all times. Slack is what we use for ordering medications. Slack is what we use for communicating with the office, for supply request, for reports. Slack is our go-to, guys, and it's very important that you use it. One thing we use Slack for is for admissions. This is where the rest of your team will get all the information provided by the person doing the admission, whether it's the RN or the LVN doing the tuck-in. This is where we will find out patient's name and address, the contact person, allergies, all of these things. Not to mention Hospice MD as well. But initially, this is where we put all the information before it's placed into Hospice MD. This is where we communicate and let our nurses know what we just seen. We document, we post pictures on there of the the latest picture of the wound or new symptoms like a rash, a cut, swelling, edema, anything that needs a visual, by the doctor, guys. We want you to go ahead and document as soon as you leave the patient's home, but it's probably better if you just document while you're there. Anything that you see, it's just like a text message. You want to post it up on Slack right away. You want to ask. The ideal visit, guys, is you go to the bedside, you do your assessment, you make any request on Slack while you're still there. You want to make sure that you reach out to the doctor, to Ella, to CHAM, whoever's involved with the care, because you want to make sure that you take care of that problem before you leave. This will give the patient peace of mind. For example, patient complains of pain. When you're at bedside, you've done your assessment, patient is complaining of pain. Hi, CHAM. Patient is complaining of pain, currently taking Tylenol. It is ineffective. Can we possibly order something stronger for pain? Mrs. Smith, I have already made the request for possible increase in pain meds. I'll get back to you shortly, Mrs. Smith. We'll continue with your assessment. You know what? I'm out of diapers. Give me 1 second, Mrs. Smith. Ella, can we please refill the diapers, or where's the monthly supply status on this? I'll have an answer for you in a second, Mrs. Smith. You continue with your visit. Next thing you know, you're getting your reply. Ding. Oh, Mrs. Smith, we've actually increased your pain medication from Tylenol to Tramadol. It looks like you'll be getting this, you'll be getting Tramadol this amount of milligrams, this amount of time per day. If you have any questions, let me know. Ding. Oh, it looks like Ella has already ordered the supplies. By the time you leave, you have taken care of the medication order, supply order, and any other request that you have. This is going to make sure that the patient has peace of mind. Patient feels important. Patient feels like a priority, and you don't carry any of this work home with you. It is taken care of at the bedside. You knocked out your work. You made the patient happy. Amici's on the job and took care of the issue. It makes us look great, guys. Everything, like I said, is based off of Slack. Maybe it's it's a concern. Maybe it's a scheduling issue. Whatever it is, guys, it's imperative that you use Slack. It is our number one way of communication. And if for some reason, guys, you don't get an answer, now remember, we're dealing with a lot of patients here, a lot of issues, pharmacy, supplies, patient concerns. There's a lot of phone calls involved in this line of nursing. So if you don't get a reply fairly soon, please, I encourage you to follow up. You know, Ella is busy, but she always has time for you. Siham is busy, but she always has time for you. If for some reason they happen to overlook the Slack, just follow up on your patient. Everybody involved here is in the care team, so just follow up. Remind Ella, hey Ella, were we able to get that order in, or can you please confirm you received the order? Or Siham, I'm sorry, not sure if you've seen the message, but just following up. Something very simple to make sure that they get a second notification so that we can attend to it. Now, it's not that, it's not that it's overlooked. It's just that sometimes, things do happen and we do have a lot of patients, but if we work together as a team, we'll definitely take care of the issue and we'll make sure you have the help and support that we provide here at Amici. With that being said, guys, I have kind of told you what Slack is for and what we use it for. Also, remember, people that are on the care team for that patient are the only ones that will be on that Slack channel. If you're a nurse that isn't on that care team for that patient, unfortunately, you will not be included due to HIPAA. If you happen to get this patient, you're doing a PRN visit, or you're doing, you're filling in for somebody, ask the office to add you to that channel, and we'll be more than happy to add you. I think that pretty much concludes our Slack reporting. Thank you very much for joining us, guys. This is Ulysses with Amici Hospice. Any questions or concerns, just give us a call at the office. Thank you, guys.